All right. Welcome everybody to I don't know what number is, the third or the fourth IDEA webinar of the COVID-19 season. Actually, the previous webinars have been TWED talks focused on tetherless world, work going on in the tetherless world constellation. Tonight, we're going to talk about a web app that students and staff in the Rensselaer Institute for Data Exploration Applications have been developing. I jointly advertised this as a Our Pirates meeting, primarily to get the interest of our students who are members of the our RPI, our users group, which is known as Our Pirates. And this is work that has been led by Kristen Bennett of the Rensselaer IDEA. She's the Associate Director of Rensselaer IDEA. And me, I am John Erickson. I am the Director of Research Operations at Rensselaer IDEA. And we've had the contributions of several students so far, and we are scaling up the project as we speak to bring on undergraduates, some recruited from our Intro to Data Math course, and some past students of IDM and potentially future students of IDM. So without further ado, I am going to flip over to, so what we have been doing for the past couple weeks is developing this web app that is utilizing COVID-19 data, in most cases daily data, published by several different sources, famously by Johns Hopkins, but a number of different other sources, COVID Tracking Project, an API provided by the New York State Department of Health, and a couple other sources, as well as some more historical sources like CDC, to create this interactive web app. And our focus is not to do what everybody else has been doing, which has been kind of tracking. What we're focused more on is to leverage some very recent research under Kristen Bennett on disparities and try to understand a little bit more about how states across the United States, as well as counties in New York State, compare either with the rest of the United States or with other countries for notable aspects. And so what you see here, this is a web app that's built in R using the Shiny framework, which lets you build interactive apps, interactive web apps using R. I'm going to kind of zoom out a little bit here. And the idea here is we've got three categories of tabs for that we're examining. One is...
I'm not seeing the screen.
You're not seeing the screen? Wow, it sucks being you. Okay, here. Let me make sure that that's being shared. Now can you see it?
Yep, got it. Thanks.
All right, I apologize. It must have been when I switched away. So here is COVIDMInder. You can get to it, covidminder.idea.rpi.edu. The link was in the announcement. And it's actually pretty easy to find even by Googling. And we see that we're covering the United States, and we're covering New York State. We've been asked by people high up in the university to apply special attention to New York State, perhaps to create some visualizations that they might find useful that they're not getting through normal sources, including themselves. We've kind of broken the tabs down by, or the examinations down by outcome. Here we're looking at the mortality rate disparity across the United States in comparison to the US average. We've got two tabs that we classify as mediation. how do the states compare with in this case, it's a country that is regarded as having done well, Korea, in their testing. Mediation in the terms of hospital beds. If you may have heard Tom and I just chatting about this, how did the U.S. states compare in their beds per thousand with Italy, which is regarded as having not done too well? Their hospital bed rate is actually slightly higher than the United States rate. A determinant, there are a couple comorbidities which indicate the severity, the potential severity of COVID-19 in patients. One is hypertension, one is diabetes. So this is a plot that shows in U.S. states, the rate of diabetes in U.S. states relative to the U.S. average. So this is showing that this belt across the southern United States is doing worse, whereas some of these states are doing better, including a couple of northern New England states. Then we have, so what I'm doing right now is I'm kind of giving you the big overview of what we've got in COVIDMINDER, and we can go back and chat. Here we've got switching modes and looking at New York State. In this case, we are looking at mortality rate disparities across New York State compared to the U.S. average. So this is not compared to the New York average. This is compared to the U.S. average. And so what you see here is, as we all know, New York, the counties close to New York is doing, has a significantly higher rate as compared to the rest of the United States. And then as you move on outward, you see it's comparable to the rest of the United States here in Ulster and Sullivan and Steuben. And then as you get further out, these rural counties are doing much better, except we got Lewis and we got Erie. And I suspect my geography ought to be a lot better after immersing myself in this for New York for more than a week. I think Syracuse is Lewis County, or it's near there. And I think Erie, I think Buffalo's out here. This is definitely this Niagara region. So this is mortality. And again, most of this data is data that we're updating daily, every morning. This is cases, case disparities. So we see here, this is this kind of correlates with the mortality. We see that in that New York adjacent area, we see that the cases are compared to the U.S. rate are much worse. And again, this is important. We've worked very, very hard that this is apples to apples. We're not looking at absolute cases here. We're looking at rates. Okay. Now, before I get into the real-time stuff, one of the things I want to show again, we showed as a determinant for USA, we looked at diabetes. Let's go across and look at New York. Okay, now this is a really interesting plot. This shows and this is based on county health rankings from Robert Wood Johnson Foundation. We see that these rural counties in New York are doing worse. I wouldn't say much worse, but they're doing worse than their disparity index indicates that they're worse than the U.S. average, even though New York itself was comparable to the U.S. average. That simply is a function of population stuff. And we do have some counties like Putnam or Tompkins, they're doing a bit better. Tompkins is right where Ithaca is, and Cornell, that sort of thing. All right, so a lot of people are showing time series plots, Epi curves. And so what we've got are two different kinds, and they show different things. So this curve, this is showing, this is a little bit mind-boggling, but again, there's something like 63, I think it's 63 counties in New York State. And what we're trying here is to show, we show almost every county time series. It's very difficult to get contiguous data over the entire pandemic for the counties in New York, the New York City area. So this New York line, which looks like a county line, is basically, it's an agglomeration. It's like the New York, it's like the counties that make up that New York City area. And then we see on top is New York State, and then we see a number of these counties. The colorization here is based on the regions of New York State. So here we've got this reference map. We're using exactly the same palette as this map. So you can see here, we've got this gray around New York City, that's there. We see, we've got Suffolk County and Nassau, those are Long Island counties, so we got those right there. Westchester is adjacent to New York City, it's right in here. So that I think it's called the, what is it, the Eastern Hudson Valley, so it's just up there. You go out a little bit further here, you got Rockland, which is right in here. So so we're seeing this. What's really fascinating is this grouping by region is kind of conveying this ruralness. Okay, we've got some, we've got this dotted line here. This is simply telling you when Governor Cuomo issued his stay-at-home order. It was, we thought it was like on the 23rd, but I actually checked that today, and it was the 20th was when he officially tweeted it, his state order. Now, what's important, so this is cumulative numbers of cases. Okay, so is that that's what a lot of people are looking at, but is that actually, what does that tell us much? Let's actually look at a different plot here. This one needs a little bit of explaining. This is cases per 100,000 population. Okay, so this is apples to apples. What we see here is right down the middle is New York State. Okay, that black line down the middle is New York State's rate. We see some of these counties that are adjacent to New York City as having higher rates. We see a bunch of the other counties, the more rural counties in New York State, having lower rates. We see the rates, the cases per 100,000 population increasing, and we do see some flattening here, okay, which means that the rate of the cases per 100,000, that rate of increase is decreasing or flattening out. We can, because we love R, we can do things like Zoom, but you can see here that it's still sort of telling us interesting things and letting us kind of correlate a bit to density, the population density. So this one's a brand new one that we just implemented today, which we're pretty excited about. But these are this series that we have here. Some things that we are really focused on. So we've got the diabetes up there right now. We're looking at suitable hypertension or total cardiovascular disease, whether we put up more mortality or prevalence. It kind of depends on the reliable data that we can get. But that's kind of the overview here. And this is a open source project, so we've got a GitHub that we're focusing on. Also, for our students in Intro to Data Math, we created and also as a sort of a boot camp, if you will, for onboarding to this project, we created a separate GitHub repository, which is essentially, it's a snapshot of this application repository, but then it has a humongous notebook in it, which breaks out each of the plots in the application as it was at that time, and allows students to, in that sort of a notebook framework rather than an application framework, play with the data and play with visualization. So they can, for example, they've got a leaflet plot like this, but it's in a notebook, and so they can twiddle with it and experiment. We've got students who have already looking at created plots like this, but they do disparity for health insurance and around the country, things like that, which is exactly kind of what we want our students to be exploring. We want them to sort of build on this. They'll come up using the notebook framework as sort of a prototyping environment. They're going to hack away, create some new kinds of plots, and then we'll integrate them into the app as soon as they look cool. So that I've used up all the oxygen in my rooms here. So what if people got questions? If you do have questions, you should probably go off mute. If people want to see something, people want me to investigate something, answer some kind of question on it.
John?
Yes. Hey, Tom.
How difficult would it be to start integrating things like income and or that kind of data in with this?
So that would actually be, it's pretty straightforward. So from our work on Mortality Minder, we found that what's called the Community Health Rankings data set, which is has been constructed by the Robert Wood Johnson Foundation. It's an aggregate data set of a number of different sources. It includes various different economic factors and ethnicities, things like that. So it is, we're already, we already have some students working on that, poring over the Community Health Rankings data set and other data sets and looking at integrating them in. Some different economic factors are certainly those, certainly a target. There are like healthcare conditions, things like food deserts. There's a whole rich selection of social determinants.
When they have education attainment?
Education's in there. Unfortunately, it doesn't say kind of, one of the things people want to know is there like some kind of indicator about whether people follow the advice of of doctors? But yes, there's education attainment is definitely one. I was looking at that this afternoon. And actually what I could do is I could bring that tab just to give everybody an idea of the kinds of factors that could be integrated in. So this is County Health Rankings, and these are different kinds of measures. They update this data set every year or so, but some of the aggregated data is a few years old. You see here, there's outcomes. So you could you could look at how does historically premature death, what does that indicate? So you could look at that spread. If there was known to be certain things like, here's an example, is if obesity was found to be prevalent comorbidity with COVID-19, you could potentially put that up there. That's not one that we've seen, but whether or not you're uninsured, the prevalence of primary care physicians, mental health providers, or the quality of care, these sorts of things. But here's the one you were specifically asking about: high school graduation rates, whether they have some college unemployment, these sorts of things, which are indicative. Hopefully my connection holds. Do you still hear me? You still, okay, good. My connection just blipped. So you can see that you could use the same sort of visualization technique to indicate potential disparities. This is in the last week, the news has been very much focused on which community. There are communities, demographics in the United States that are being harder hit than others due to socioeconomic factors, and that we definitely want to jump on that. You see things like food insecurity. So these are the kinds of factors that we could potentially utilize in here, based on or driven by what if there's an association with COVID that's known. I think people saw, many of the people on this call have seen Mortality Minder. The whole idea here is to try to understand the relationship of different social determinants to premature death in the United States. And the idea is being able to select for certain causes of death, trying to understand the different socioeconomic or social determinants that correlate to that death for that particular state. And so it's no mistake that COVIDMINDER borrows from the Mortality Minder name. We want to provide a similar sort of ability to explore these factors. But we're trying to do it. It took us 9 months to build Mortality Minder. It's taken us a little over 2 weeks to build COVIDMINDER. We're working at a different pace with a different sense of urgency, and some of the niceties of and sophistication in application development of Mortality Minder we're not worried about right now. We're more worried about getting the interactive visualizations. Although we do like our WYSI R for doing certain things. So any other questions? That was a good one, Tom, and that's very important because that's exactly the direction we want to go. We have some of our students who have just joined the COVIDMINDER team on the call, and the kinds of things that they can look forward to doing on the project. Where as the days and weeks go on, we're going to make this a little bit easier to navigate, so it's going to be a bit more modal. So Mortality Minder was there was a different scales of view where we went from a nationwide view to a state view to a factor view where we were examining the factors, the determinants in greater detail. And it was highly dynamic with the display changing with the interaction. We see a similar direction for COVIDMINDER where it's going to be kind of a nationwide view, answering questions about outcomes and mediation and determinants at that U.S. level, and then a state-focused view. And we've got lots of different things. This cases this case rate, or cases per 100,000 population, was actually something that some of our friends in New York State, who we spoke with yesterday, were asking about. They felt that showing the relative rates and the changing of those rates over time is more insightful than just the classic Epi Curves, which themselves are kind of useful. I mean, if you look at this infographic here, if you view this as an infographic, what do you see? You see this is a log curve. You see a nearly a straight line with some increase, which meant it's wickedly what do you call it, exponential, up to this point in time, which happens to be when Governor Cuomo issued his stay-at-home order. And then you happen to see a trailing off of that slope, which means that rate of increase was decreasing. So when they talk about flattening, they could be talking about this kind of flattening. This kind of flattening is much more meaningful, where we see the rates tapering off. But still, that's So what you were seeing is that, for example, here, we see this. I have to click right on the time there. So that's telling us that there's a rate in the state of 172 COVID-19 cases per 100. Yeah, that's a pretty extreme rate. I'm gonna have to check some of these numbers, I think, but that's so that's the deal, and we're working on. It's kind of a hard problem when you got so many counties in a state. How do you show useful information? Mostly the fact that these counties are relatively low is a good thing. Let me go back to the chat, see if there's been any other.
John, can I ask a question?
Sure, John Lachlan. What's up?
John, this is very nice. I was wondering, are you guys planning to show the number of recoveries per 100,000? Like, I know you're focusing on, it's like the inverse of it. I see the data is coming up now for recovery.
Well, that's there. I won't say we're planning on it. I think so. That would be useful insofar as we could. So it's what we're trying to show our focus has been on these disparities. So if there was an angle where we could show it, I mean, certainly we could kind of show it comparatively, but like an interesting question is, which counties are doing better at recovery than other counties are doing? That might be interesting. So we're trying to go with the guidance of some of our external experts, the same people who helped guide us with Mortality Minder. We had executives at United Health Foundation, New York State Department of Health, CDPHP, and a few others who advised us on the direction of Mortality Minder. And some of those same people are coaching us and asking key questions with COVIDMINDER to try to get us to make sure that we're asking robust questions and doing something that others aren't. We also are kind of keen to provide something that's very useful to New York State. So the real answer to your question is if they need it, we'll do it. That's kind of the bottom line. If we're not going to do things, we can propose things. We've got a number of students working on the project. We can have them prototyping different views of the data, but really it's about what do the people on the front lines and the people making decisions really need? What aren't they getting right now? And there's a lot of people, data scientists out there trying to help, trying to model. There's these predictive models. We're trying to do something a little bit different right now than the predictive modeling. But if there's a hole out there and that would be useful, we'll do it. We're not going to do it because other people are doing it. That's for sure. But that's a good question, Tilanka. Other questions?
I have a question. Is it possible that if you click on the region, you just show that region? Or you mean like you do in Plotly or whatever it's called?
Yes, of course it is.
Yeah, because that would be kind of nice if you just kind of did that.
Yeah,
Because then you could say, oh, let's just look at the Capital District. How are we doing? Let's do Capital District versus New York average,
Yes, we could do that. So what we're doing here is, even though it's interactive, it's actually not Plotly. We would have got that automatically from Plotly. But we also would have got a crappier looking view. This is basically a straight ggplot implemented via Shiny and then using this. But I'll have it for you tomorrow morning, Kristen.
See, don't you love this? This is how we develop. Could you?
That's right.
I just thought that might be a little clearer. You just look
No,
at the ones you're interested in.
Actually,
Yeah.
somebody asked for that. Somebody. I feel like in the last, well, it would have had to be in the last 10 hours, but because it didn't exist before then. But I feel like probably my wife asked for that. Am I allowed to have her file issues too?
Sure, anybody can.
But and actually, yeah. So one of the other questions, a friend from high school who was reviewing this last night or looking at it, he was looking for. So here's an example. For testing, we compare United States against the rate of testing in South Korea, which is known to be was regarded as having been good. Okay, and so and obviously the availability of hospital beds is important for treating. Now, and so when we look at this, United States, we look at the disparity indexes, we see how many of the states are doing somewhat worse than South Korea. We see some that are doing the same and some that are doing better. But the question is, why South Korea? Okay, I'm telling you what the rate is for the United States, which is about, using historical data, is about 2.3, and South Korea is about 3.1. Japan is like 11, Germany is like 8. So obviously, but why? Why? So is there some way to make it clearer why South Korea would be a good one or a useful one to compare United States against? Actually, that was testing. I may have mixed up the numbers, and maybe a hospital beds was the other one. Italy. The numbers I just cited were Italy and hospital beds. I'm sorry. Testing with South Korea was a different thing. So this is hospital beds against Italy. Italy is a little bit better, but Italy really suffered deaths and cases pretty badly. So this is not a good picture from that perspective for the United States. And so the question is, why? You know, why Italy? Why are we looking at that? Is there some way to sort of usefully so illustrate?
It's a sentence. It says that. I mean, maybe you don't notice it, but it says until Italy has a higher hospital bed rate than U.S., yet still face challenges meeting peak COVID bed needs.
No, yeah. So I know it's there, and my friend observed that, but it's sort of
put it somewhere else, or
well, it's just no. It's not so much a sentence, but is there a way to sort of visually? I think what he was looking for is like, yeah, he felt if COVIDMInder was like a big old worldwide tool, there would be like a way you progress from what countries are worse, what countries are better, select that, compare against, use that as the basis kind of a thing. I'm not saying we should do that. I'm just saying.
Definitely, I think that we should have an option that lets you change the base rate. Because why Italy is absolutely right. So we should let you select from different things. And that was always my, we can file an issue, guys, if anybody wants to work on that, because maybe you just want to do the US average. Maybe you want to compare it to some other country. So we could offer, you know, some different rates, and you can pick whichever one you want. I mean, I think that would be completely rationally and a good idea.
That's a, and I think that makes, I think it makes more sense now how that would look and stuff. It's, yeah, I think these ideas first came up even when we were prototyping, and it takes a little while for them to soak in. But for those kind of comparative ones, you would definitely want to have that. Kristen, was there anything else you wanted to say? I sort of jumped into this at the top of the hour, and
I think you did an excellent job. Thank you very much. I'm just interested what other people's comments and suggestions might be.
Yeah. Let's see who we've got on. Maybe we should pretend we're Professor Plaka and call on people.
I'm interested in like the. I'm sorry. This is Joe.
Yeah, go ahead, Joe.
Oh, yeah, I'm interested in the quality of the data. I mean, I know we have very little control over that, but one thing that I noticed, because I've been following a few counties that I have relatives in New York, and it's strange, if you use Bing and search COVID, you know, they have their tracker that pops right up, and Rockland County, which is up there for having quite a few number of cases, it's near New York City.
Yeah, I know.
They had like nobody listed as recovered a few days ago, and now all of a sudden they have 5,000 people listed as recovered, whereas Orange County, that's right next to them in terms of number of cases, they still have nobody listed as recovered. And so I don't know if that's just a function of how Bing is updating the data, or if it's, you know, how the counties are reporting the data. But
so I could speak to that, because I've been, so first thing to say is that you kind of, there's a lot of passing along the data. So it's so you can get Johns Hopkins providing it. You can New York State has an API for a very nice API for testing and cases, and a so-so API for some other things. New York Times has a feed. There's a number of different feeds, and if you watch them day over day, I think that the real answer to your question is, if you're looking at this time series stuff, there tends to be kind of a reconciliation of this stuff. I'll give an example. Because of how the New York State Department of Health is providing it, and the limitations on how they're providing it, I have to go in every morning and to a table that they have of fatalities, and hand transcribe that table of. So I'm looking at the death count for New York State every morning at about 5:30, and adding it in. And I usually see things increasing, but there have been a couple of cases, situations where I've seen a death go away. and that wasn't even right around Easter. So it's I think that there is some reconciliation where they tally it from one place to another. I will say that the way New York State, and this is a partial answer to your question, Joe. New York State has, let me go, do I have the, oh, I think we took off some of the explanation. They have like about 4 different criteria for what county okay, I'm looking at the wrong thing. Sorry about that. If I look, is it cases, or there's about 4 different criteria that New York State uses for what county they associate a case with or a fatality with, and it's from it's like the county that the person resides in, the county where the person works in, the county that filed the test, the county that this, so and that's how they used to tabulate and associate. And so if you saw, like, if you see a fatality go away, or fatality, it's basically a fatality moving from one county to the next as they work on if some reconciliation of the data. But that's basically it. I can only speak to at that fine grain level to New York, because I've only been swimming in the county level data for New York, even though it's coming from, Johns Hopkins has been amazing in their production of the data and aggregation of the data. But there are other sources. We get COVID Tracking Project is what we use for some of this COVID traffic. So we're using that for that. What are we using COVID Tracking Project? I can't remember right now. But COVID Tracking Projects, CTP, it's got some great, I bet it's over. Sorry, I'm trying to track down where that was. I can't remember. So there's different sources and we're doing different things. And for the purposes of this, we just have to be watchful. And we're still polishing our data pipeline as well. There's a lot of, anybody who's a database person here, inner join and left join are our friends. Which speaks to, for those of you, Deborah McGinnis, who are semantic web people, this notion of linked data, it really would be super helpful if we had this data provided in triple stores to be able to link in, to join in county data much more quickly than we're currently doing using normal database-oriented techniques. Any other questions? If not, I'm going to close this up. I'm going to advertise our talk. We're going to have a talk by Andrew Yale next week at this same time, the same format. Andrew is going to, hopefully without an earthquake and other crazy things happening, is going to give us a talk centered on his, basically his thesis defense. He's going to, well, that's going to be the general theme, talking about his synthetic data work, which is very, very cool, and ties into this health stuff in amazing ways. So that'll be next week. And if you've got any questions, please, questions about COVIDMInder, or want to lend a hand with COVIDMInder, please be in contact with myself or Kristen Bennett. We've got GitHubs, we've got this, we've got that. You know, every way to Sunday, you know, Google will find it. And you can also find it at the, it's highlighted on the IDEA website, idea.rpi.edu. We've got links to that, as well as our COVID-19 resources page, which highlights data sources, highlights cool visualizations that people have created. There's a ton of tutorials on working with COVID data, working with epidemiological packages, and as I said, a variety of sources. So stop by idea.rpi.edu for lots of COVID-related resources. And with that, I'll thank myself.
Thing, John?
Oh,
Can
yeah,
I
go
add
ahead.
one little thing? Yeah, I think this is our pirates related one. Since we're all here, we should collectively unmute and give a collective R.
There we go.
The pirates.
Everybody
yeah, like
unmute.
Unmute and you know, like you say R like a pirate. Okay.
Arr.
Arr. Arr.
Arr. Thank you, Kristen, for
Arr. Okay, I just figured we need some joint activity.
We're, you know,
Thank
people
you, John.
don't get the joke. We are the only institution who can be the R pirates. You know, this.
Yeah, I noticed. You can chat if you don't want to unmute. You can just say it in the chat if you like.
Hey, Anne, thank you so much for joining us. That was awesome. And I should say there will be a recording of this available. It takes about 24 hours for it to get through the WebEx grinder, the way WebEx is working these days, and it will be available via the IDEA website, the media section as well. All right. So thank you very much.
Thank you.
Have a great evening.
Nice job. Good job. Bye.